Morning. Now, I do want to reflect a little bit on that Penny Mordaunt statement with Tom Harwood, who is here with me. But we've just got to do one quick story because we've got a couple of GPs and I've been trailing this story. And you know it's your show, so you asked for us to talk about this. But I promise you we will reflect on what Penny Mordaunt just said. Around 1 million people with asthma are relying on reliever inhalers to manage their condition. But Asthma and Lung UK have said that 1 in 5 people are using the wrong inhaler and increasing their risk of illness. So joining me now to discuss this further is GP Dr. Mike Smith. Hello, Mike, and thank you ever so much for hanging on. It's obviously a bit of a rolling news show today with everything that's going on. First of all, why are so many patients, and many of them will be watching this, using the wrong sort of inhalers for asthma?
So it's not so much they're using the wrong inhaler. I think that they're using the wrong inhaler at the wrong time is what we're supposed to mean. But broadly speaking, there's 2 types of inhaler with people with asthma. There's the ones that prevent asthma getting worse or asthma attacks, for want of a better word. And there's those that relieve the symptoms of asthma and the symptoms of an asthma attack. And what we're finding is about 1 in 5 people in a recent report from Asthma UK are relying on the reliever inhaler, the typically blue inhaler, rather than using their preventers to stop getting sick in the first place. Now, once again, I think that that's because it provides immediate relief to their symptoms. And the problem with the preventer is you don't see the effects immediately. You see it sort of a day or 2 or 3 days afterwards. And also it's getting the habit of doing it twice in the morning and twice in the evening. So I do understand why it happens. But actually, the other thing, or the other part of this is that the national guidelines for prescribing for asthma mean that we don't automatically prescribe a preventer. Now, a lot of GPs do because they know that's better, but actually what we probably need is a change in the national guidelines overall.
And what else can people be doing, Dr. Smith, to help their asthma condition? Because it sounds like if people aren't taking enough medication, maybe they're reluctant to take so much medication on a daily basis. So what else can people do if they're struggling?
Well, I think that's a really good question, Bev, and please call me Mike. Dr. Smith sounds so formal. I look behind me when someone calls me Dr. Smith. I'm not that generation that insists on being called doctor.
We've only just met. We've only just met, Mike. Don't worry. It's Mike from now on.
No, I know, absolutely. So what can people do? I think that it's paying attention to their symptoms. I think it's, a lot of people, they don't notice over a long period of time their symptoms getting worse. The fact that they're using more and more of their blue inhaler on a weekly basis, particularly when pollen counts are up, particularly when there's infections in the air, etc. So some people don't realise that actually the amount of blue inhaler that they're using is going up, and if they're finding themselves requesting more of it, then a lot of the time that is a sign that actually you probably need a bit of a tweak in your asthma care. And remember, there's not just one preventer, there's lots of different preventers. So sometimes it requires stepping it up and going a little bit further. Hands up, there is a problem with people having regular asthma reviews. And the last 3 years, that's been quite bad in terms of, we've not been able to get people in to do their face-to-face reviews, and we've got a massive backlog. I know we as GPs could probably be better at doing asthma reviews more face-to-face. And the final part of that is probably everyone needs an asthma plan. Everyone probably needs to have a written plan or at least a texted plan from their asthma nurse in the practice about what to do when certain things happen. So I'd say that they were the main things that people could do, asthma sufferers.